We have access to a lot of claim information, so medical claim and pharmacy claim information. We have electronic medical record information. We partner with provider organizations. We have consumer data that we actually purchase and utilize. Social determinants of health, so things like health literacy would be an example of that. Eligibility information, just a number of different types, and of course, it's all we use de-identified information. So we've certainly managed are aware of contractual and privacy considerations. So we use the data to understand things, as an example, trends, cost trends, utilization trends. Total cost of care is a really big thing that we hear in the industry, value-based care, trying to understand where there are inefficiencies in healthcare delivery that cause cost impact or negative outcomes. And so we use the data to really understand populations, how they're performing, what the trends are. We look at provider organizations and provider networks and do the similar things. We actually provide that information to providers to help them because they don't necessarily have the analytic capabilities. And then also doing more and more with artificial intelligence and prediction and prescriptive models to help make sure that people get the care that they need when they need it. Examples would be prediction around diabetes, so identifying individuals who are high-risk diabetics that could benefit from outreach. Atrial fibrillation would be another clinical example where it's often underdiagnosed 20 to 30% of the time. So we can use machine learning and deep learning models to identify those individuals even though they may not have a diagnosis code, and provide that information to physicians so that they get the services that they need so that they don't have things like strokes and other negative outcomes. Yeah, I think a lot of the chronic conditions, heart failure, coronary artery disease, hypertension, asthma, those types, I think are all great candidates, both to understand and predict that individuals have those conditions, but also to begin to understand where they are in their journey through that condition, from pre-diabetes through to having diabetes, through to different stages or levels of severity through that condition, so that you can tailor intervention and services to support that individual. And obviously the goal is to prevent the progression of those conditions. I think down the road, as I think we're earlier on in our journey of using artificial intelligence across healthcare, I think if we get to the place where you have chatbots and virtual assistants like Alexa, as an example, providing services or providing recommendations and replacing physicians. I'm not saying we're doing that, but I think that if the field evolves to that level of sophistication, obviously there's a lot to think about to make sure that that we also incorporate human intelligence and judgment and compassion and those types of things into the care delivery process.